chronic pain. It's like such
Yeah.
a widespread challenge, affects so many people. And finding treatments that really work consistently is, well, it's tough.
It really is.
Medical cannabis often comes up, as a potential option.
Hmm.
But one of the biggest hurdles, it seems, is always the dosing. How much? How often?
You've hit on the central problem, yeah. Physicians, patients,
Mm.
they struggle. Without knowing the dose, getting consistent results is, well, it's kind of guesswork sometimes.
Feels like flying blind.
Exactly. And, without consistent standardized dosing and reliable delivery, it makes proper research incredibly difficult. Building treatment protocols that actually work within healthcare systems, almost impossible.
Right. And that's really why we wanted to do this deep dive today. We found a fascinating study that tackles this exact challenge head on.
Ah,
It's
okay.
a paper from the European Journal of Pain titled The Pharmacokinetics, Efficacy, and Safety of a Novel Selective-Dose Cannabis Inhaler in Patients with Chronic Pain.
Okay, so a clinical trial. Looking at a specific device, it sounds like.
Precisely. A new medical device designed to deliver cannabis differently. It's called the SyqeAir Inhaler.
The SyqeAir Inhaler, got it.
And our mission today, really, is to unpack what this study found. How does this inhaler work in terms of delivering cannabis? Does it actually help with pain? Is it safe? And, what could this all mean to the future?
Sounds good. Where should we start? Maybe setting the scene a bit, the context.
Yeah, let's do that. The paper itself reiterates chronic pain is by far the most common reason people turn to medical cannabis.
That's definitely true. But as the paper also points out, the actual evidence on how well it works for chronic pain, it's been a bit conflicting, hasn't it?
It has. You see reviews, reports. Some find minimal benefit. Others suggest moderate effects. Though the big NASM report did find substantial evidence for chronic pain.
Right, the National Academy's report. And part of that variability in findings might just come down to how people are using it.
The delivery method.
Exactly. Smoking obviously carries combustion risks. But even some other methods, like certain types of vaporization or edibles, they can lead to really inconsistent absorption. The amount of THC, CBD, whatever, it can vary wildly from dose to dose, person to person.
Which makes standard dosing almost impossible. If you can't reliably get the same amount into the system each time, well, how can doctors prescribe effectively? How can patients get predictable relief?
You can't. It hinders research, too. There's a real pressing need for delivery systems that meet, proper pharmaceutical standards.
Yeah.
Consistency, reliability.
Which brings us neatly back to this study and the SyqeAir Inhaler.
Right. So what is this device, according to the paper?
Okay, it's described as portable, handheld, battery-operated, and it uses software control. The technology is called thermal selective dose inhalation, or TSDI.
Formal selective dose inhalation.
Okay.
And it uses raw plant material.
Yeah, granulated raw plants. In this study, it was specifically cannabis flower, or flyus, as they call it. And it's designed to aerosolize this material to deliver multiple doses.
Interesting. And what makes it different? What are the key features they highlight?
Well, first, it's non-combustion, which is important. But the really crucial part seems to be the automatic thermal and flow controllers.
Ah, okay. What do those do?
They're designed to ensure that the delivery of the cannabinoid aerosol to the lungs is basically independent of how the patient inhales. So whether you take a slow breath, a fast breath, the aim is consistent delivery.
That is a big deal. Patient inhalation patterns are a huge source of variability, usually.
Right. It also electronically controls and logs the whole process, and it's programmed to deliver specific metered doses. For this trial, they focused on 0.5 milligrams and 1.0 milligrams of THC aerosol per inhalation.
Very small doses, metered doses, so aiming for individualization.
Exactly, and they did quality control testing on the device beforehand. It showed really impressive uniformity in the actual delivered dose, meaning for the 0.5 milligram setting, the average delivered dose was almost exactly 0.5 milligrams, with very little variation. Same for the 1.0 milligram setting. That level of consistency from a plant product is quite something.
Okay, so we have a device designed for consistent, uniform, metered low dosing. How do they actually test its effects in patients?
Right. The study design was pretty robust. A randomized, 3-arm, double-blinded, placebo-controlled crossover trial.
Okay, let's break that down. Randomized, double-blind, placebo-controlled. That's the gold standard. Crossover means each patient acts as their own control.
Exactly. Each patient experienced all 3 conditions.
And who are the patients?
They recruited 27 adults. These were people already licensed to use medical cannabis, so not naive users. And they all had chronic pain, specifically neuropathic pain or complex regional pain syndrome, CRPS.
Which are often very difficult, types of pain to treat.
Definitely. And they had significant pain at the start, averaging 6 or more on a 10-point scale.
Okay. And the intervention, what did they actually do?
Each patient came in for 3 separate visits. On each visit, they received a single inhalation from the SyqeAir Inhaler. One time it was 0.5 milligram THC, another time 1.0 milligram THC, and the third time it was a placebo.
And the order was randomized, and neither the patient nor the clinical staff knew which dose they were getting on any given day.
Correct. That's the double blinding, to minimize bias.
Makes sense. So what did they measure? What were the results?
They looked at a few key things. First, pharmacokinetics. That's basically how the body handles the drug, how quickly it gets into the bloodstream, how high the concentration gets, how long it stays there. They took blood samples over about 2.5 hours after that single inhalation.
And what did they find with these low doses from the SyqeAir Inhaler?
Really interesting results. The THC levels in the blood peaked very, very quickly.
How quickly?
For the 0.5 milligram dose, the average time to peak concentration, Tmax, was just 3.7 minutes. For the 1.0 milligram dose, it was about 4.4 minutes.
Wow, that's fast. Under 5 minutes.
Super fast. And the peak concentration itself, the Cmax, for 0.5 milligrams, it averaged about 14 nanograms per milliliter. For 1.0 milligrams, it averaged almost 34 energy milliliters.
Okay, so doubling the dose delivered by the inhaler nearly doubled the peak concentration.
Exactly. It also nearly doubled the total exposure, the AUC. This strongly suggests a clear dose-dependent relationship. What the inhaler delivers seems to translate directly and proportionally into bloodstream levels.
Which points back to that consistent delivery mechanism working as intended. That kind of predictability is often missing with other methods, especially smoking, where concentrations can be all over the place.
Right. The paper explicitly contrasts this with the high variability seen in smoking studies. So it gets into the system fast, and the amount seems predictable based on the metered dose. But the million-dollar question for patients: did it actually reduce their pain?
The main efficacy outcome, yes. How did they measure that?
They used a standard tool, the Visual Analog Scale, or VAS. Patients marked their pain level on a line from 0, no pain, to 10, worst imaginable pain.
Okay. And baseline scores were high, around 7.5, you said?
Yeah, roughly 7.4 to 7.8 across the groups at baseline. No significant difference before the inhalation.
And after using the inhaler?
Big difference. Both the 0.5 milligram and the 1.0 milligram THC doses led to a statistically significant reduction in pain intensity compared to baseline.
And compared to placebo?
Yes. Critically, the placebo group did not show a significant reduction, so the effect seems specific to the THC.
Okay. And was there a difference between the two active doses? Did more THC mean more pain relief?
Yes, there was. And this is another really key finding. The 1.0 milligram dose produced a statistically significantly greater reduction in pain compared to both the placebo and the lower 0.5 milligram dose.
Ah, so a clear dose response for pain relief too, even at these very low levels. That's quite remarkable.
It is. They actually
Yeah.
quantify it. The average maximum drop in pain score was about 1.95 points for the 0.5 milligram dose
Okay.
and 2.95 points for the 1.0 milligram dose.
So roughly a 25% reduction for the lower dose and almost a 40% reduction for the higher dose from their baseline pain. That's clinically meaningful for many patients.
Definitely. And they looked at responder rates too. They defined a responder as someone who had at least a 2-point drop in their pain score.
A common threshold used in pain studies?
Right. By 120 minutes after the inhalation, about 64% of patients who got the 0.5 milligram dose were responders. And nearly 70%, 69.57% to be exact, of those who got the 1.0 milligram dose were responders.
Impressive rates for a single, very low dose.
The authors themselves state they believe this study is the first to really demonstrate this clear dose-response effect at such low inhaled THC doses for both the pharmacokinetics, how it gets in the body, and the efficacy, the pain relief.
And that really hinges on the inhaler's ability to deliver those doses so uniformly and consistently. It allows those subtle differences between 0.5 and 1.0 milligram to actually show up as statistically different effects.
Makes sense. Okay, so the pain relief looks promising. The delivery seems consistent. What about the flip side? Safety, side effects, cognitive function. Always a concern with THC.
Understandably, they tracked adverse events, or AEs, closely. The overall safety profile looked pretty good for these low doses.
How so?
Most AEs reported were rated as mild, and they resolved on their own, spontaneously, within the 2.5-hour observation period. Importantly, no serious adverse events were linked to the study treatment.
Okay, what kind of mild things do people experience?
The usual suspects, you might say, for THC inhalation: Things like feeling high, maybe a cough during inhalation, some feeling of weakness or restlessness, dry mouth, dizziness, sleepiness, occasionally nausea.
And were those more common with the THC doses compared to placebo?
Generally, yes. They were reported more frequently with the zero point 0.5 milligram and 1.0 milligram doses than with the placebo, as you'd probably expect.
Did the side effects also show a dose response? More side effects with the higher dose?
They did. They tended to peak within about 15 to 30 minutes after inhalation and were more common or pronounced with the 1.0 milligram dose. It suggests that both the good effects, the pain relief, and the less desired effects are related to that meter dose from the inhaler.
What about vital signs? Blood pressure, heart rate?
They saw some temporary dose-dependent changes, specifically some decreases in diastolic blood pressure and some shifts in heart rate, but these effects were transient and tended to head back towards baseline within the study period.
Okay. And the big one, cognition. Did these low doses impair thinking?
They used a set of standardized computer-based cognitive tests, the CANTAP battery. These tests measure things like reaction time, memory, attention.
Right.
And the headline finding was no evidence of consistent impairments in cognitive performance at these doses.
No consistent impairment, so maybe some small blips, but nothing clearer across the board.
Exactly. They noted some minor, statistically non-significant indications on one or two specific test measures, but emphasized the overall lack of a reliable, consistent negative effect on cognitive function with either the zero point 0.5 or 1.0 milligram dose in this setting.
That's quite encouraging, especially given the rapid peak THC levels.
It is. So putting it all together, what's the big picture here?
Yeah, connecting the dots. It seems this study provides pretty solid evidence, doesn't it, that using the SyqeAir Inhaler to deliver these metered, very low doses of THC can actually provide significant pain relief for chronic pain patients.
With a side effect profile that seems generally mild and manageable and without clear cognitive impairment in this acute setting.
And it really underscores that maybe you don't need huge doses of THC to get a therapeutic effect for pain.
Precisely. It opens up the possibility, or maybe strengthens the argument, for finding a therapeutic window. That sweet spot where you maximize the pain relief but minimize the unwanted side effects like psychoactivity by using these small, consistent, incremental dose adjustments.
Just think about those doses. Again, 0.5 milligrams, 1.0 milligram as a single dose. Compare that to what the paper mentions is common practice in some places, 0.67 grams up to 3 grams of cannabis flower per day.
It's a completely different scale. We're talking milligrams versus grams. That's potentially orders of magnitude less THC being consumed overall.
And they even cite another study, a previous one, using the same SyqeAir Inhaler in hospitalized patients. The median daily dose used there was only 1.5 milligrams of THC total.
1.5 milligrams per day. If that holds true more broadly, it could mean something like a 20-fold reduction in the amount of cannabis someone needs per month compared to, say, smoking several grams a day. Huge implications for cost, access, and maybe reducing potential long-term risks.
That potential for effective relief with much lower meter doses also seems to line up with some other research mentioned in the paper, right? Like the Wilsey and Wallace trials.
Yes, those studies also suggested that even relatively low doses of inhaled or vaporized cannabis could be effective, particularly for neuropathic pain.
But the key innovation here seems to be the delivery system, the inhaler itself, its ability to provide those low doses so uniformly and consistently.
Absolutely. That predictability is what makes finding an individual's optimal dose feasible. It allows for proper titration, like you do with conventional pharmaceuticals. It really moves medical cannabis treatment much closer to accepted medical standards.
Now, we should be fair. The authors do point out some limitations to this study.
Of course. No study is perfect. They mention, for instance, that these were experienced cannabis users. The effects, both good and bad, might be different in people trying cannabis for the first time.
Good point. And this was only single-dose administration. We saw the effects over 2.5 hours, but what about long-term daily use? We need studies looking at that for efficacy and safety over weeks or months.
Definitely. They also only tested 2 low doses of THC from one specific cannabis type. Future work should probably explore a wider dose range, maybe higher doses too, and different chemovars, perhaps CBD-rich options or balanced THC-CBD ratios using the same delivery system.
And there's always the challenge of blinding when you have active psychoactive effects, though they did try to manage that.
Right. It's hard to fully blind THC, but the placebo control and the crossover design help strengthen the conclusions. They also noted potential drug interactions weren't deeply explored, though patients were on stable meds.
Okay. So wrapping up this deep dive on the SyqeAir Inhaler study, the core takeaway seems to be that delivering these very low meter doses of THC via this specific device was shown here to be safe and effective for reducing pain in chronic pain patients.
And critically, it suggests a path towards potentially much, much lower overall cannabis consumption compared to current typical methods by leveraging consistent and uniform delivery.
The real innovation seems to be that consistent low-dose delivery capability. That's what could enable predictable effects, true individualization of treatment, and maybe bring medical cannabis more into line with pharmaceutical standards.
It definitely pushes things in that direction.
So thinking about this, if you can get meaningful pain relief with such small metered amounts delivered reliably, what does that suggest to you about our understanding of the minimum effective dose of cannabis for different conditions? And more broadly, how could devices like the SyqeAir Inhaler actually change the game for prescribing practices? And even how we research cannabis therapeutics in the future, it really gives you something to chew on.